Namaskar. Hello. Today we'll be talking on the benefits of breastfeeding just for not the baby, also for you. So as you embark on this wonderful journey of breastfeeding for your child for the first 6 months, we want you to know the what are the benefits for the baby and you, that you are more encouraged and more confident of taking a choice of breastfeeding and exclusively breastfeeding your child for the first 6 months of his life. So what are the benefits for the baby? Your breastfeed is a wholesome meal for the baby. It has a good mix and it is very balanced. It contains the appropriate amount of fats, of sugars, of carbohydrate, of vitamins, of minerals, and of water. So for the first 6 months of life, we don't even need to give extra water to the child. Only the breastfeeding is more than enough for the baby. Your breast milk also contains a good amount of immunological factors like antibodies, which help your child to fight from viruses and bacterial and other infections. So breastfed babies have been shown that they are less prone to ear infection, respiratory infection, and other infections in early childhood when they are breastfeeding. It has been shown that breastfed child have a higher cognitive function. Their IQ is greater than those children who have not been exclusively breastfed. So breastfeeding not only helps your child for the growth and immunology, but it also helps the child to develop better, to have a better IQ, and also helps in the future life. It has been shown in studies that breastfed children have less chances of chronic illnesses. Chronic illnesses like in blood pressure, diabetes, asthma, even some types of cancer are less frequent in children who have been exclusively breastfed for 6 months of life than those children who have not been breastfed. So breastfeeding not only helps your child during the first 6 months or the first year of life, but it is a something we are providing which helps them throughout their life. During the early childhood, the baby requires an emotional, tender, loving care contact. So breastfeeding is going to provide the baby exactly what it needs other than the nutrition. The contact, the connect which the baby had had in the pregnancy and throughout breastfeeding will make the transition of the baby to this world a very easy one. Now we'll talk about the benefits for you. What are the benefits of breastfeeding not only for the baby but also for the mother? Breastfeeding is not only good for your baby, it is also good for you. Breastfeeding has tremendous benefits also on mothers. Breastfeeding helps in reducing your uterus size, which has increased tremendously during the pregnancy to its normal non-pregnant state. Breastfeeding also helps to stop bleeding, like what we call postpartum bleeding in mothers. Breastfeeding has been shown to reduce few sorts of cancers which are common in women, such as ovarian cancer and breast cancer. So the timing of breastfeeding, the more you breastfeed, there's less chances of having such cancers in you. There is lots of weight gain during pregnancy. Breastfeeding is a way to lose a lot of calories through the breastfeed. So breastfeeding will also help you in reducing your weight. Breastfeeding helps to make your bones stronger and prevent osteoporosis later in life. During breastfeed, your body will constantly and actively absorb calcium and vitamin D, which is going to be deposited in your bones and make them stronger. The other very common thing that breastfeed gives to a lot of women in our country is the cost effectiveness, because breastfeeding is available anytime, everywhere, and at the right temperature. And the other thing, it does not cost anything to the mothers or to the family. So it is very cost effective and easily available anytime to the baby wants. Many mothers go through a state of depression during the postpartum after pregnancy period. This breastfeeding is going to give them confidence, and it even creates an emotional bond for the baby and child like we had discussed before. So breastfeeding is not only good for your child, it is also good for you. So please take a decision, a very concrete decision, a very informed decision that you are going to breastfeed your child for at least the first 6 months of life, and if possible to continue up to 2 years of life. Breastfeeding may be difficult for you in the initial stages, but do take help, maybe a lactational counselor or maybe a pediatrician or maybe a gynecologist. Whomever you are comfortable talking to, please do talk, and if required, take help.